All right. Good afternoon. I'm Dr. Sandra Martell of the Winnebago County Health Department, and today I wanted to give you an update about the Chemtool fire and the release of the Public Health Impact Survey. So we've been going about two and a half weeks at this point through the Chemtool. We talked about the fire suppression phase, life safety phase, the environmental phase, and now we're really kind of in the health impact measuring phase. So with support by the Illinois Department of Public Health and the Centers for Disease Control and Prevention, the Agency for Toxic Substances and Disease Registry, I know that sounds more frightening than usual, but this is the group that studies it within the Centers for Disease Control and Prevention, we will be doing a health impact survey. The team has been working over the past 2 weeks to develop the plan, gather information from the public, figure out what kinds of questions should be asked based on what has been reported throughout the last couple of weeks. And the goal of the survey is to better understand the impact of the Chemtool fire on the health of individuals who are in the area. And that includes first responders, volunteers, if you were shopping, if you were a passerby in that area. So the survey is open to everyone who may have felt that they've been impacted. The questions were developed and vetted by the toxicologists, the epidemiologists, and the environmental health scientists based on previous chemical fires and what was on the Chemtool event. So when the individuals go on to the Chemtool survey, they're going to be asked some demographic questions. These are very familiar to everyone here, but for demographics, for things like name and birth date, address, locations that they were in. We're going to ask some very questions about where were you at the time of the event? What did you have contact with? Was it debris? Was it ash? Was it air? Was it water? Any symptoms you may be having, including both physical and mental health symptoms. If you sought healthcare services. And of course, there will be a question on pets and livestock because we learned from many of the calls coming in that people have pets and we do have livestock in that area. And so there will be a question related to that, which usually you don't see on a health impact survey. Our survey is going to be distributed through our Qualtrics platform, which was used for the COVID-19 response for the registration and vaccination effort. The link is pushed out through the Winnebago County Health Department website on our front page and also the Chemtool page, which is www.wchd.org. In addition, we will be pushing out the survey to individuals in designated impacted zip codes in the Rockton area who had previously registered for COVID-19 vaccines. So we're going to do both an active push out to individuals who had registered for vaccine in the area based on their zip code, and passive. So you can go on that website, you can take the survey, you can answer the questions. There are some important considerations about the survey. It is voluntary, but we are looking for a large response for those who are in the area at the time of the event. All responses on individuals will be kept confidential, but the data will be analyzed in what we call aggregate. We're going to combine all the responses so that we get a complete picture of what the impacts were to our community. If you are under the age of 18, consent from parent or legal guardian is required for you to complete the survey. And surveys can be completed. If you have a household of 4 with children, complete them for your children as well. Additional follow-up may be conducted with individuals based on their responses on the survey. So there's one of the last questions is, do you have pet or livestock? So there may be another survey or an interview may contact you to learn more about those pets and livestock and your experiences with them. The survey should take not more than 15 minutes to complete. You can use your tablet, your iPhone, or a computer. If you do not have access to technology, assistance can be provided through the Chemtool hotline, through the Winnebago County Health Department at 815-972-7300. Again, that number is 815-972-7300. I want to be clear with the public that this survey is not intended to be used as a medical screening tool. If you need health care, you need to contact your primary care provider or seek health care. The survey is intended to really understand the symptoms that you experienced. There should be no assumption that the survey is implying that there are hazardous materials have been identified in the area. Again, our goal is to get a total picture of the impacts. After this week, next week, we will have members of the CDC and the Illinois Department of Public Health will have boots on the ground in our region as well. So we're pushing out this survey in advance, so we'll be able to start some data collection prior to their arrival, so we can get to the next phase of what are the next important questions for those follow-up surveys to be done. Some of those will be conducted in person. Some of them will be conducted again by another survey being sent to you. I also want to provide an update on the environmental health update, because we know people continue to have questions about that. The Illinois Environmental Protection Agency is the lead agency in the response. Air, water, and land samples have been taken. The results continue to be posted on the Illinois EPA website because they are the owner of the detailed results. And that is open, available to the public through their website. At last review, the Rock River continues to remain closed to recreational boat traffic by the Illinois Department of Natural Resources to support response efforts. We still have people in the area, still cleaning, still removing debris and from that. So we want to make sure that all the responders are safe. Air quality samples have been fairly stable with the reporting levels below federal regulatory standards. And I know every so often you'll see other people blogging about it. You'll get some, we talked about the inversion layer, you make it a little tick up and then it comes back down. The idea being if we saw a sustained level of elevation is when there is concern. Wastewater and runoff from the Rock River samples have been tested for what we call VOCs, or volatile organic compounds, SVOCs, which are semi-volatile organic compound, metals, biologic oxygen demand, and of course the PFAS and the PFOs. And again, the samples continue to show that they are within standards established by the Illinois Pollution Control Board. There has been some exception related to the Chemtool, what they call frac tank, which is actually on the Chemtool site itself, which is a little bit different than the surrounding area. So that is the one site that has consistently had some issues and concerns. But we have to be reminded that the Chemtool area and that factory site was a former Superfund cleanup site. So again, some of the environmental impacts persist there. At the Winnebago County Health Department, we continue to operate our hotline and our email for the residents to respond. It's at Rockton Chemfire at wchd.org, or the phone number that we gave earlier, and I'll give that again. And we are taking calls Monday through Friday from 8 to 5. It may take us some time to respond on some of the questions because we then go back to the agencies that are involved in that response to make sure that our responses are appropriate and have been vetted. So if it's a question regarding agriculture, we often have to go through the Department of Ag to make sure that we are providing vetted, accurate, and timely information to the public. Just a reminder, while we are taking calls, we will be closed Monday, July 5th in observance of the July 4th holiday. So in summary, the health impact provides an additional layer with the environmental health data, so the two will be analyzed together to better understand the impact of the Chemtool fire on our community and ensure that appropriate strategies and mitigations are being implemented to protect the whole health of the community. The response is ongoing and information is being shared as it becomes available. I want to remind the public both the US EPA is posting all of the air monitoring sample results on its website, and the Illinois Environmental Protection Agency is also posting their data on the site. And again, if you have any questions and do not have access to technology, please contact us at 815-972-7300. That is the Chemtool hotline number for us at the Winnebago County Health Department. You'll be speaking directly to Health Department staff, or email us at Rockton, R-O-C-K-T-O-N, Chem, we're going to put this all together, R-O-C-K-T-O-N-C-H-E-M-F-I-R-E at wchd.org. To date, we have handled over 150 inquiries from the community and provided guidance. And where possible and when it's appropriate, we've developed that information sheet that we have also shared with another community who is also being devastated by a fire on a lithium battery factory. So we are sharing our lessons learned, and we continue to work through this process. So with that, I'm happy to take any questions.
Dr. Martell.